So pregnancy actually brings a lot of changes to a woman. All right, there's a lot of adjustment. The body is adjusting now. This is because pregnancy is a very it's a very special state. You get, it's a very special state. So for what we have, talking about the physiological and the chemistry changes that a woman might experience in pregnancy, we have the plasma volume. It's increasing by 45%. So the increase is contributed more by an increase in plasma water than increase in red blood cells. Do you understand? So plasma, fluid is the one that is actually increasing the most. All right. Glomerular filtration rate is increased in pregnancy. Hemoglobin concentration is what decreased in pregnancy. Now this is because there's a whole lot of dilutions and all. Factors contributing to fluid retention. All right. So sodium retention, resetting of what osmostat, decrease plasma oncotic pressure. Then what? Proteins. Formation of protein is increased, right? Most especially fibrinogen and clotting factors, by the liver. So albumin synthesis on the other side is decreased. Do you understand? So this is for preparation for what? Hemostatic challenge of delivery. Now fibrinogen and clotting factors are increased. This is because in childbirth the woman loses a lot of blood. Do you understand? So the body is preparing itself so that once blood starts, clotting is coming up and all. You understand? There's no increase in synthesis of transport, proteins. All this results in what? Increase erythrocyte sedimentation rate, making a pregnant woman more prone to thromboembolism. So that's why you could see some pregnant women, they might have some 1 or 2 clotting issues and all. So hormones like corticosteroid has increased, thyroxine are increased, all due to what? Increase in their protein bindings, in the binding proteins, but free hormone components may be normal. Estrogens are increased. So now if it is increased, it will now cause a negative feedback on the pituitary gland. The pituitary gland will now stop producing, will reduce producing luteinizing hormone, follicle stimulating hormone. You understand? So all these changes in estrogen, luteinizing hormone, follicle stimulating hormone, prolactin makes a pregnant woman not to be able to what? Menstruate. You understand? So that's just it. So enzymes like alkaline phosphatase are increased. Creatine kinase is increased. Then there's reduced what? Hepatic synthesis of plasma cholinesterase. Renal function. Glomerular filtration rate is increased. Clearance is increased of creatinine, urea, and uric acid is increased. This is because even their production is increased. You understand? So in the blood, that's in the plasma now, you have low levels of creatinine, urea, and uric acid. Then general metabolism. All right. So lipid production is high. So there's high triglycerides, there's high cholesterol, there's high free fatty acids. So those are the various changes a woman should see in her chemistry and physiology once she's pregnant.